define reversible. That's not easy. But what matters is that a low-carb or ketogenic diet increases metabolic flexibility and decreases pathological insulin resistance. In so doing, it decreases cardiovascular risk factors and improves overall health. Many diabetics don't even need external insulin or other diabetic medications when following a ketogenic diet. A ketogenic diet's beneficial for type 1 diabetics. Type 1 diabetes is not caused by insulin resistance, but it still makes sense to lower the need for insulin. Because type 1 diabetics hardly produce any insulin, they rely on external insulin when following a standard high-carb diet. Through carb restriction, a ketogenic diet decreases the need for insulin. In some type 1 diabetics, their insulin production is sufficient when following a ketogenic diet. Others still need to inject insulin, but much less than on a high-carb diet. Overall, it is much easier to control blood sugar levels with injected insulin on a ketogenic diet because blood glucose raises only mildly after meals. In fact, a recent survey of the Type 1 GRIT Facebook group established the valuable proof of principle. Managing type 1 diabetes with a well-formulated ketogenic diet results in astonishingly improved control of blood sugars. 8. In the words of the authors, they say, exceptional control of T1DM without increased risk of adverse events. What should a diabetic eat on a keto diet? The ketogenic diet is by definition ideal for diabetics, no matter if they have type 1 or type 2 diabetes. However, they need to follow it more strictly since it is a real therapy for their disease. The most important thing that diabetics have to learn is that there is no reason to avoid fat, not even saturated fat. It is not saturated fat that causes arteriosclerosis and heart disease, but an excess of refined carbohydrates like sugar and flour. Seed oils are implicated in the disease, although by other mechanisms that involve damaged lipids and mitochondrial toxins. Healthy fats are crucial on a ketogenic diet, but people who have been following the official dietary advice don't know what healthy fats are. In short, all natural fats that you find in fish, meat, nuts, olives, coconut, and full-fat raw dairy products are healthy for diabetics. On the other hand, oxidized seed oils and the trans fats in margarine should be avoided. Learn more about good fats versus bad fats here. The same is true for meat. You've probably been told to avoid red meat when in fact you should not. Meat is an integral part of any diet, including the ketogenic diet. There is no reason to avoid it. Okay, you're excused if you've been bitten by a Lone Star tick. The ketogenic diet reduces cardiovascular risk factors and improves the lipid profile by increasing HDL and lowering triglycerides. 9, 10. These foods belong to a ketogenic diet. All kinds of meat, organ meats, seafood, and fish, nuts and seeds, vegetables, preferably leafy greens and mushrooms, small amounts of low-sugar fruits, such as berries, and even smaller amounts of starchy vegetables like carrots, full-fat dairy products and eggs, coconut oil, olive oil, butter, ghee and lard. Starchy foods, all kind of grains and anything that contains refined carbs should be avoided. Is the keto diet safe for diabetics? Many people and even some doctors confuse nutritional ketosis with diabetic ketoacidosis. Ketoacidosis occurs in uncontrolled diabetes when the pancreas cannot secrete enough insulin to exert its action in cells, so blood glucose levels and blood ketones both skyrocket to dangerously high levels. Ketoacidosis has nothing to do with nutritional ketosis, which is when ketones are produced from all the dietary fat you're relying on and can thus keep your blood sugar levels under